All right, so welcome everybody today to the webinar. My name is Dr. Leah Baluch. I had approached the Office of Diversity to give this webinar today as an introduction to Islam and Ramadan, a healthcare perspective. I appreciate everyone's time coming or going to their computers and listening to us during, a busy day, of course. So without further ado, we'll go ahead and get started. Everyone should be able to see my slides as well. The speakers, like I mentioned, I'm Aliyah Baluch. I work here at Moffitt. We just wanted to give a couple introductory tidbits about us. I'm an infectious disease attending over in the bone marrow transplant unit. I'm half Pakistani, half American. I grew up in 3 different countries. I'm very happy to be part of this panel of Muslim persons. We just happen to all be female. We come from different backgrounds, different fields. For example, Jasmine Al-Najjar is one of our nurses. She also works in bone marrow transplant, and though she works nights, she's helping us out today. She's actually been at Moffitt since 2013. Dr. Nadia Noor is our physician representative. Is in private practice as an internal medicine physician. She's a mom of 3, and a little tongue-in-cheek, she's known me since she was 16, and I've known her since I was 18, so young friends from college. Anse Redana is, she is an IRS enrolled agent for tax accounting, and while doing her full-time job, she also has been for over 20 years been teaching and volunteering as a teacher in Islamic studies. She has 4 children and 3 grandchildren. So we all have our different backgrounds coming today to give this webinar. Our goals and objectives is a brief introduction to Islam, understand key elements or key points of interacting with a Muslim patient and his or her family members, whether it is in the outpatient setting or inpatient setting. These are different issues, of course, that are pertinent. And then because the month of Ramadan started this past Monday, we felt that it was a good time to discuss some key elements about this special month. So what is Islam? If someone, stopped and asked you what were some kind of just important information about Islam, it is a monotheistic and Abrahamic religion like Christianity and Judaism. Followers are called Muslims. Our main religious text is the Quran. You might hear Muslims also speaking about sayings of Prophet Muhammad, that he had hadith, but still the main book is called the Quran. And as we also believe in the other prophets, peace be upon them, from the Abrahamic religion, Prophet Muhammad is the main and the last one that we discussed. A word about food, because this is always an important thing that comes up. Halal is used in reference to specifically meat products and how the animal is killed. It's different from kosher in the Judaism line of thought, in that kosher food includes vegetables as well as meat products. And then also for Muslims, that there are 2 things that are not recommended at all. That would be alcohol or pork-based products. And though, like where I grew up, for example, pepperoni pizza is actually made from beef. Here in the United States, you have to be careful because pepperoni traditionally is pork. Pork comes in many different varieties, and you have to be sometimes very detail-oriented when you ask that question. In terms of clothing, there are general recommendations. For example, it should be loose-fitting, non-see-through for Muslims. And then in addition, for women, that it should cover the entire body, ideally including hair and neck. So in the hospital, for example, an application of that would be consider offering an inpatient female Muslim patient a second gown. We actually have temporary pants that are apparently greenish in color that are held in stores. You just have to ask for them, as well as additional blankets if they so need. For men, they also have to cover from the navel to the knees, also this loose-fitting, non-see-through clothing. As just some examples of different styles of headwear, traditionally you'll see, especially out in the community, the Tampa Bay, a number of women wearing hijab. The chador is a different style of clothing used predominantly in the Persian community. Niqab is in reference to a specific style of face veil. And then burqa is traditionally coming out of the Afghan or Pashtun communities. The idea is just to kind of show a variety of different styles, trying to, again, fit this loose-fitting covering. But then you have all the different cultural overtones that depending where you are in the world, it could be interpreted in many different ways, as shown by this fashion show. And then not to be left out are the men. Again, loose-fitting clothes. You might have something like on the far left, which is a thobe more from what we call the Gulf countries, like Saudi Arabia, Qatar, to something more Pakistani in the center, all the way over to like what might be worn in Burma or Southeast Asia, to T-shirts and jeans would be also considered loose-fitting clothing. In Islam, there are 5 pillars of Islam where it discusses the main tenets of the faith. The Shahada, which is a declaration of faith, there is no God but Allah and Muhammad is his messenger. Salah is prayers. This is 5 times praying towards the direction of Mecca. We'll talk a little bit more about that. Zakat is in surplus amount of money that you make that you are supposed to give a specific percentage for the needy or poor. Fasting during the month of Ramadan, and Hajj, if possible, and one has the means and the health. Muslims are to go to Mecca for pilgrimage in a specific time of the year once in their lifetime. Talking about prayers in detail, because this does come up whether on the inpatient or outpatient service, prayers don't have a dedicated time on a clock that is based on where the sun is. For example, Fajr prayer is the morning prayer, as you can see by the graphic, that you have this narrow window here, and then you go towards the day, you actually have sunrise. Once it's past the highest point, Zuhr is this component described as the early afternoon prayer. Asr then has this next section, which is the late afternoon prayer. Then Maghrib is sunset, and then Isha, you have the rest of the night to do. So you're like, okay, well, this is then the theoretical timing. What about right now? So last Friday, I looked up on one of the apps on my own iPhone, being like, okay, what exactly is the time right now? And you can see here that right now, about 5:19 in the morning is Fajr, followed by then, say, sunset, which is at 8:23 p.m. The reason I point these out is that when we talk about Ramadan or the month of fasting, you have your fasting during daylight hours. So right now, about 5:19 to 8:23. In terms of the direction of prayers, this is called the Qibla, that it's towards Makkah. So as a way of being cohesive for the Muslim community, we all pray the same direction. So a patient in the hospital could ask you, well, which direction am I supposed to pray? And it's traditionally northeast from North America, and that any one of us that have smartphones, you can download or have an app directing you in the correct direction. It can then be marked, for example, on the floor with a piece of tape to help them remember which is the direction that they need to pray. A couple just general elements. If you saw a patient or family member of a patient praying, you try not to walk in front of them, and definitely because prayers in the Muslim faith tend to be very short, less than 5 minutes, that to consider returning to the patient if it's not a stat issue. What about Ramadan? Because that's what kind of brought this whole subject to the forefront. What is it? And it's actually the name of the month. And then you're like, well, how long is it? It's a lunar month, so 28, 29, 30 days based on the lunar calendar. When is it, or what is it? It's a month of fasting. at first glance, yes, it's no eating, drinking, smoking, or sex during daylight hours while fasting. But the more important thing is you kind of quiet out the noise of daily life so that you are supposed to then go back and study religious texts more. You're supposed to try to just think positively, no backbiting, no gossiping during this time of month. Be the best person that you can be during this month. And then the question about when is it, so you need to actually look then at an Islamic calendar. And I just want to point out, so the black ink, for example, is the Gregorian calendar, and then the green ink is the Islamic calendar. So for right now, Ramadan started on, and I apologize for that, June 6th. So that was this past Monday. And the other point to note from this calendar is that our year is different because it has a different starting point upon when the Prophet got the information about the Quran. What about holidays? There are two main holidays for the Muslim community. Eid al-Fitr is the first day of Shawwal, which is the next month after Ramadan, as a celebration that, we've done a good job with Ramadan, that we've been, for example, reciting the Quran and have done our fasting. Eid al-Adha then is our other high holiday, which occurs on the 10th day of Dhul Hijjah. This is recognizing that Prophet Abraham, was willing to sacrifice his son as an act of submission to God's command. Well, why is this important? This was one of the main points that the Office of Diversity wanted me to expand upon. Well, why even bring up this subject here at Moffitt? And the idea is that it is important simply by numbers that these are our patients. For example, 1.6 billion Muslims as of 2010 that were in the global population. You're like, okay, well, what about the United States? You're like, okay, well, now it's the third largest faith in the U.S. after Christianity and Judaism. And you can see the other numbers of the other faiths that are in our community. You're like, well, what about Florida or the Tampa Bay? And this is a really cool graphic that I picked up showing by color where the huge populations, and especially dense populations of Muslims, you can see we have out in California a large spread around certain areas in Michigan, and that actually Florida has quite a bit all in one state and not spread out. And the Tampa Bay area is definitely one of those areas. We have enough well-organized Muslims that we have 2 parochial schools from kindergarten to 12th grade, and from my understanding, there is a 3rd school that is starting to be made that will soon join the ranks of the other 2. So what about Islam and healthcare? Because that's why we're joined together, is see what are the differences that we need to be aware of for our patients and how to take care of them. In terms of shaking hands, you should ideally try to minimize physical contact with the opposite sex if not directly related to patient care. For example, as a male physician seeing a female patient, if it's not related to the actual physical exam, trying to minimize, direct contact. And we'll talk about it a lot later as well. Physical exam, if at all you feel uncomfortable or the patient feels uncomfortable, to be honest, the likelihood is there's going to be a family member, but in case there's not, always consider the use of chaperone for, especially an invasive physical exam. There's no harm in that. In terms of pork and alcohol waivers, definitely if the treatment is considered life-sustaining and there are no other readily available options, it is allowed. It's definitely not black or white. And with that, I'm actually going to segue over to Jasmine Al-Najjar to discuss our nursing perspective. Jasmine?
Hello. Can you hear me?
I can definitely hear you.
Okay, so I'm going to go over the nursing perspective. So just some tips when you're going into patients' rooms. Just make sure you knock on the door before you enter. If the patient is female or has female family members, they may need to put their headscarf on, especially overnight when they're asleep. They may take off their headscarf, so just give them a few minutes just to put their veil back on. Like Dr. Baluch mentioned about food restrictions, for dietary options, you can offer the patient a vegetarian diet, and some patients may be okay with a seafood-only diet because I don't think we have any halal meat options right now. In terms of staff, usually the patient would prefer same-sex techs and nurses, but you can always ask the patient for their own personal preference. In terms of prayers are normally done on the floor using a prayer rug, but you could offer a chair to your patient instead, especially if they're neutropenic or have a low hemoglobin or platelet count. You don't want them to be at risk for bleeding because prayers do involve kneeling and prostrating, so just a cautious thing for them. And then OR nurses, you can offer your like an OR cap, a hair cap for the female patients who are going for surgical procedures just for some modesty purposes. And that's it. Thank you, Dr. Baluch.
Thank you, Jasmine. And then, though, of course, if there are additional questions that come up, you guys will be able to type them in. Just kind of note them to yourself if they come up, and we'll discuss them at the end. In terms of the physician perspective, I'm going to hand it over to Dr. Nadia Noor. Are you there?
Yes, I am. Thank you, Dr. Baluch, for inviting me. Assalamu alaikum. This is a greeting amongst Muslims, which means peace be on you, in case our audience isn't aware. Thank you all for tuning in. Since we're in the month of Ramadan, a lot of folks shrink at the thought of people fasting for 15 to 16-hour days and wonder if it's a safe practice. Except in certain cases, for example, a patient with an eating disorder or someone who has a life-threatening illness, fasting can be generally considered safe and even beneficial. A quick search on PubMed yields several articles with regards to fasting. In the interest of time, I'll go over some salient points, and I'm happy to provide all my references. The New England Journal of Medicine published an article in 1970 on the liver biopsies of 41 obese patients who were treated with fasting versus low-calorie dieting versus intestinal bypass surgery. The first two groups manifested an increase in, quote, the degree of hepatocellular degeneration, focal necrosis, along with progressive diminution of fatty infiltration during weight loss. And late follow-up biopsies revealed histologically normal livers. With an overwhelming obesity and related metabolic syndrome epidemic, such as fatty liver disease, high blood pressure, insulin resistance, the benefits of fasting are definitely there. More relevant to Moffitt might be a study published in the scientific peer-reviewed journal Cell, which reported that fasting prior to chemotherapy protected against its toxicity and regenerated immune systems damaged by aging or cancer treatment. The popular 5-2 diet style is based on this study brought to my attention by the late-night show host Jimmy Kimmel. I believe he fasts on Mondays and Thursdays every week. But my purpose is not to recommend this as a treatment for your patients. My hope is that we, as healthcare professionals, don't alienate our Muslim patients by recommending a blanket prohibition on fasting. Fasting in the month of Ramadan is an obligation that practicing Muslims take seriously and believe it contributes to their spiritual, psychological, physical, and social well-being. The patient would need to look into several factors for medically clearing a Muslim patient. First, review their past medical history. In the adult patient population, chances are that your patient is not fasting for the first time. So assess how they performed during their previous Ramadan. Did they, as a diabetic, for example, have hypoglycemic events? Did the patient with a history of renal stones have a flare-up? The questions can be as diverse as the medical history itself, and you can explore why they had these problems and help mitigate them. Then, assess their current medical issues. The patient might be coming to Moffitt because of a new cancer diagnosis. Is this an inpatient or outpatient evaluation? The inpatient population generally is more critical. If they're requiring IV fluids or emergent blood transfusions, yes, we can receive blood transfusions, by the way, or have recurrent copious emesis, or they're cachectic and requiring appetite stimulants, they're likely not candidates for fasting. If your patient is not critical, however, you can accommodate their fast by altering the timing of their daily medication regimen, adjusting doses, postponing elective procedures, and routine blood draws. You can also encourage some general dietary recommendations. For example, hydrate adequately during non-fasting hours, wake up for the pre-dawn meal or the suhoor, and eat a high-fiber meal that will last you all day, such as whole grains, fruits, vegetables, and nuts. Avoiding excessive fatty, greasy, salty, sugary, caffeine-inundated food that might exacerbate and cause dehydration. At the time of breaking a fast, recommending a nutritious meal with plenty of fluids, and of course avoiding an excess, which can be counterproductive and exacerbate chronic medical conditions. Other non-dietary recommendations would be to stay cool for the day and avoiding excessive strenuous activity, getting rest not necessarily by sleeping all day, but perhaps by avoiding non-essential activity. I had a couple other points, not only relevant to Ramadan, but will help you in dealing with your Muslim patient. If a patient informs you or you happen to know that a medicine has alcohol or pork products, please work with them and find an alternative. Heparin, for example, is porcine-based. A synthetic alternative would be fondaparinux. Also, when prescribing oral medications, simply ordering tablets as opposed to capsules will be helpful since capsules are mainly made of pork gelatin. For the cardiac patient requiring an aortic valve replacement, consider using the bovine valve versus porcine valve if mechanical valve is not an option. If it's a life or death situation, as Dr. Baluch mentioned earlier, all bets are off. To save a life, anything can be used. I hope our talk gives you some awareness and some food for thought, no pun intended, for a meaningful dialogue with your Muslim patient and colleagues. Thank you. Back to you, Dr. Baluch.
Thank you, Nadia. So, moving next, Anse Redana, it's up for you now. Anse Redana, can you hear us?
Hello?
Yes, we can all hear you.
Okay, all right. Well, first I want to thank Moffitt Center for their positive response to your initiative. This is really taking a very good job they're doing already to a higher standard in patient care. I really appreciate it. I pretty much feel like the outsider here because everybody, and you're in the same profession. So I wanted to make sure that I extend my thanks. Now, I'm here to talk about the juristic and the spiritual side of Ramadan from an Islamic perspective, from the eye of a Muslim. Of course, I can answer all the questions about the juristic, rulings about Ramadan. But for now, we'll talk a little bit about the spiritual side of it. So probably will give you more appreciation as to what your patients are, feeling at this month or trying to achieve in this month. When you ask a Muslim, you probably have to ask your patients, why do you fast? Of course, for Muslims, you're going to get probably the same answers all the time. It's like it's God's command. Trusting in God's wisdom is pretty much reason number one, and there are definitely some of this wisdom can be revealed to us. We know a lot of it, and some we do not. We'll go about that a little bit. As a Muslim, I would tell you that, we look at the human being as two basic components. So we are body and soul. We take very much good care of our bodies. We feed it, we treat it. We come to you guys to take care of it a lot of the times. But Ramadan would be the month or the time of the year that is intended to give a little bit of a priority to the other component, which is our soul. Of course, the fasting is not restricted to Ramadan. It's a Muslim fast on weekly, monthly, annual basis also. So that's something you would see throughout the year in your patients and not just in Ramadan. Of course, as I said, that, the most known or recognized aspect of fasting is refraining from food and drink and sexual relations, for the duration of the day. But that is not, that's really not that's only one facet of the fast, Islam requests that fasting includes the entire being. So like Dr. Baluch said in the beginning, the entire senses and limbs should be fasting to the best of one's ability from all prohibited actions, Islamically. So your eyes, your ears, your tongue, everything has boundaries, and you're observing these boundaries in that month. And actually it's recommended also to take it a little bit, that fasting is taken a notch further by not just refraining from the prohibited, but also trying to have less of the excess, worldly excess, less of the excess of everything, let's say. So, of course, again, trusting in God's wisdom, which is really what most of your patients will respond as a reason for fasting. Fasting does have, on a personal and a society level, does have an effect. On a personal level, let's say, it is really like an intensive course in willpower and training one's willpower. So when you can stay without, food and drink and sexual relations and watch what your eyes are seeing, what your ears are hearing, what your tongue is saying. If you can control this for 14, 15, 16 hours, no matter what, you are more likely to be really in command of everything. You're more likely, even medically, to be immune to certain addictions, food disorders, eating disorders, or smoking, or any of these things. If you can give up a cigarette for 14 or 15 hours, you definitely have proven to yourself that you can do it. And actually, a lot of people do that. That is on a personal level. As I said, it's really an amazing, intensive course in willpower. On a society level, let's say how fast will reflect to other. Not only we are refraining from gossiping and bad mouthing and all this stuff that we're supposed to be away from, but the highlight of this is that it is usually much easier to think of those who have less when you have less. It is easier to think of the hungry when our stomach is empty than it is to think of them when our stomach is full. So fasting is supposed to, reflect in more sensitivity and a softer heart and a consideration for those who have less. An amazing thing about fasting, too, is that it is the one worship that you actually can take with you. It's the one type of worship that you do not have to take time off from your daily schedule, and that's the challenge in fasting. So you're not taking 5 minutes off like the prayer, and okay, I can concentrate for 5 minutes, I can control myself for 5 minutes, but it is actually the worship that goes with you along in your day, accompanies you in every activity you're doing, imposes itself on your activities. There are a lot of course, circumstances that would allow a Muslim individual not to fast. Health issues, of course, by a recommendation from a Muslim doctor or at least an educated doctor, which that's why I appreciate this session, a doctor educated of the importance of fasting for the Muslims, so they're not quick to say, oh, you don't have to fast or this fast will hurt you. A traveler, a certain situation like a pregnant woman, a nursing lady, many situations, an older person who is incapable. So this falls under the jurist section of Ramadan, and I'll be very happy to answer any question for any health professional or anyone who would like to know more about this subject. I don't know if I have, I know that we have 5 to 7 minutes. I think I'm done with my time, and I'm going to turn it back to you, Dr. Baluch.
Thank you so much, Aunt Saradana. Oh, okay.
You're very welcome.
Just to add a couple other elements with this that most of us in the community will also acknowledge, we look forward to this time of the year because as busy as we get nowadays, and things are fragmented with this person going for sports, this person going for other activities, that during Ramadan, everybody gets up before Fajr prayer to eat. Everybody comes together at sunset to open their fast called Iftar. So, I definitely have always looked forward to this time of the year because it just is a time for everyone to come back and kind of reset that clock. As a couple last slides, Dr. Holmstrom had recommended to integrate into this webinar just a couple words about end of life, what kind of questions are allowed or should be still asked of a Muslim patient, that organ donation is allowed, cremation is never allowed, and that depending on the situation, if it's, necessity, autopsy can be done, but ideally autopsy is not recommended because of this kind of overarching bottom line, which is that burial preparations have to be done as soon as possible for a Muslim patient. It requires washing of the body, funeral prayers called janazah prayers, and then burial. And there are specific cemeteries for the Muslim community that, say if you had a patient die, actually with Google funeral services for Muslims, this was the first website that even popped up, that it kind of walks you through who would you need to call for the actual, prayers versus the actual cemetery. So just coming full circle with the highlights, Islam is an Abrahamic monotheistic religion. Ramadan is a month of fasting during daylight hours. And truly, please do not hesitate to ask the patient and his or her family members if you need clarification of needs, because even though there are, the 5 pillars of Islam, there are many, sub-schools or interpretations of how things are done or how an individual does items. And so with that, I will actually happily give my note of appreciation to the Moffitt Office of Diversity. We couldn't have done this without Dr. Green, Kathy, Desiree, and Leslie, and of course Zach, who's helping us with the webinar. And that please send me your questions via text in the chat box, and then we'll be able to respond. Thank you very much. Well, people are getting their minds together for some questions. I have actually a question for Dr. Noor or Anse Redana about topical pain medicines or patches that give medicines 24 hours or 12 hours at a time. So, for example, a lidoderm patch, is this allowed when you're fasting or not allowed when you are fasting?
The one thing that might want to be careful of is that would consider probably to break the fast is just very simple to administer or to consume any medication, orally or through any of the body's natural opening, like suppositories would break somebody's fast, swallowing, medication, water, stuff like that. But any needle, any administration of medication through shots, through patches, they do not break a person's fast, so they're allowed.
Okay, thank you. So I'm getting a couple texts. Hold on, let me go backwards. So yes, Dr. Quillets had asked or just wanted to clarify capsules versus tablets. Yes, this is important because the fact that the majority of capsules have gelatin, which is why I unfortunately have trouble finding multivitamins, because most of them are the jelly version, the chewy version. So yes, for our Muslim patients and for other communities that don't take in pork gelatin, we should be offering them tablets. As to exceptions to fasting, if there are health concerns, yes. As Dr. Noor and Anse Redana said, there are specific exemptions to fasting. For example, if you're acutely ill and in sepsis, for example, and in the ICU, you're not going to be fasting because you're so sick you're in the hospital. The next person who asked, what would be an appropriate greeting during Ramadan? So for Muslims, actually, Jasmine, I'll let you take that one. What's an appropriate thing to say for Ramadan, like Happy Ramadan?
I guess you could just say that, but we normally say like Ramadan Mubarak, or that means welcome Ramadan. But I don't know really what else to say.
Yes, no, I agree. Happy Ramadan or Ramadan Mubarak or Ramadan Mabruk. these are the kind of three variations, and you can say it to any Muslim who's following Ramadan. And then, of course, the holiday, the first day of the new month after Ramadan, you would say Eid Mubarak.
Which is probably, you wanna explain that Mubarak means blessed.
That is also appropriate on Sayyidana. Yes, Mubarak means blessed, so it's literally a translation of Happy Ramadan. Okay, the next question is so this is for Nadia. We're getting asked, because we try to avoid porcine-derived health products like heparin, what about factor concentrates? Did you see anything when you were doing PubMed about factor concentrates? It's coming from the blood bank.
Yeah, I'm not sure if I know the answer to that, to be honest with you. I'd have to look that up. I've realized I've opened a Pandora's box here, and there's going to be so many things, and it's something that I'm learning as I go as well, because I took things for granted before. But I'm sorry, I'll have to look that up and hopefully get back to you.
No, understood. I think it kind of is the same idea, though, like with the heparin, that if someone cannot get, say, fondaparinux and has to get heparin because it's the shortest acting, it has a reversal agent, I suspect it comes under the same category. If that's the only and the best option, then most likely it's allowed. If there are other options, then that is the better way to go. Would you not agree in general?
Yeah.
Okay. Anse Redana, anything to add to that before we go to the next question?
No, sweetie, you're doing very well.
Okay. We get another question, which actually I've heard often on one-to-one discussions. In Judaism, they have very nice categories to describe their community. For example, Orthodox versus Reformed. The question is saying, for Muslims, do we have such categories? And if not, how do you elucidate? So how would you answer that, Anse Redana?
Well, actually, in what I've seen, whether in Judaism or Christianity, the standard that they classify these classes according to pretty much has to do with the adherence of the people to the letter of the law, or to the to how much of a practicing people are they. So when people adhere to the letter of their books and try to follow very adequately and stuff, most of the time they're pretty much considered of the Orthodox, or the more fundamentals in their understanding and practice. I mean, there isn't such a thing as, in every religion, Islam is like any other religion. You have different level of practice between people. You have the very committed, the ones who really, prioritize their religion in every aspect of their life. And this is, found in Judaism, Christianity, or Islam. You have them, what you call the, like the Friday Muslims, or the Sunday Christians, or the ones who consider religion as an addition to their life, not as a way of life, because we believe of religion being a way of life and not something you add as a spice. So I don't think that Islam is very different than any other religion in that aspect, that there are the very adherent or the very committed, and there are the loose followers, and there are the ones who completely do not, probably do not recognize religion altogether, the authority of religion altogether in their lives. There isn't a specific name for that. We do not classify. It's just a matter of how much you observe your religion.
Right. No, I would agree that we don't have specific titles. It's it's more visual in that how do they live their life, how integrated, or how much of it is the backbone of the daily life, and not so much in a label. But you can still ask a patient or patient's family to try to elucidate this, how important is Islam to you? How much do you practice on a daily basis? And that, does it help dictate, for example, your care? That's an open question that you can ask. There's not a problem with asking patients.
Well, if I may say something, Dr. Baluch, here is
sure.
that usually the patients, and I know for myself, I've been here for 32 years, but there was time where I felt, intimidated by being in a different, let's say, environment, or people who do not know what I value or not. But you don't have probably to ask your patient too much about their religious preference, but just to give them a quick note that if you feel that you're uncomfortable with something, or your belief dictates a different path, please be comfortable, or don't hesitate to tell me. I mean, we don't have to go by asking them how, what's the level of their commitment, but as long as we can reassure them that do not be intimidated into accepting something you feel you shouldn't, that would be, I think, sufficient.
Okay, perfect. Nadia or Jasmine, there was a question specifically, Muslims with diabetes, blood sugar, and Ramadan. Did you want to give anything extra about this, say medications versus, say, insulin?
So basically, there are those diabetics that are very sensitive, and they have difficulty fasting because of recurrent hypoglycemic events. But, there's a huge population of diabetics, and so a lot of them are not like that. A lot of them are controlled with oral hypoglycemics. A lot of them may be taking insulin, and that their long-acting insulin may be adjusted or decreased. They may not need to take their short-acting insulin with their breakfast or their pre-dawn meal, so they don't crash during the daytime. And again, eating foods that will hopefully sustain them. But obviously, not every diabetic is the same. Some are very sensitive and brittle. And if that is the case, I had a patient, for example, she, she wasn't my patient. She's a fellow nurse. She ended up needing some medical care while she was fasting. But I don't know how much she had discussed this with her primary care doctor, or how she was dealing with her diabetes. But that's where the doctor comes into play. If you are open, and if you tell them that this is what you're going to be doing, maybe you can kind of come up with a plan to adjust your doses, or the timing of the doses, etc.
Thank you, Dr. Noor. And in the interim, I had sent out a text message because someone had asked me. I know, for example, the supportive care meeting that's weekly is during Wednesday at noon, that this entire webinar is being recorded with the goal of being posted, I believe, on the Office of Diversity's website, so that you can go back if you want to, re-listen to it, or if there are sections that you missed because you were taking care of patients. That definitely, it should be available on the Moffitt intranet. Okay. So as of right now, we kind of went through all the questions. Are there any other additional information from the panelists that you wanted to speak up now that kind of came up to you while the rest of us were talking? Anybody? Jasmine, anything to add?
No.
No? Nadia, anything from your side?
I'm sure there's lots of different things we could be talking about, but I think we've covered the basic general issues that I think an average Muslim would be concerned with.
Okay, and Anse Redana, any closing remarks?
No, actually, beside the fact that, I want to thank everybody for this initiative. I really appreciate it. I have not been part of one before. I mean, if you leave it to me and you let me to speak, I probably will speak for 2 hours, but that's not really what we're here for. So I want to thank everybody, and I want to tell you, if you have any questions regarding this, I know there are multiple Muslim doctors in Moffitt. I'm always available at whether at ISTABA, the Islamic Society of the Tampa Bay area, or at Qassam Masjid, which is, the ICT Hall, the Islamic Community of Tampa. I know that there are multiple efforts in the hospitals, in schools, in colleges, and everything to really educate people. And that is a wonderful thing. I really appreciate what you guys are doing. So please, you can pass my number or email to anybody who would be willing to, to expand this effort to other institutions.
That is very true. Thank you for mentioning the different mosques in the area. There's always lots of resources to tap into, whether or not it's the religious aspect of our patients or even the psychosocial component that they need people just in the community to come and talk to them. We've done that for a number of different patients that come from areas outside of the Tampa Bay, because Moffitt is a referral center. So keep that in mind. And again, for all of those that are listening to the webinar, I'm Aliyah Baluch. I work here at Moffitt. You can look me up in SmartWeb and send me any email questions if you don't feel comfortable asking in this venue. And with that, without further ado, we'll go ahead and close this webinar. Thank you so much for participating, everybody.